You said that very well, that we've now outlined the problem, I think, in a frightened detail. And we now have to figure out how the practices that we have built and love are going to sustain this, and how we're going to manage to take care of the patients who have no idea what's coming. So part of the strength of ONCare Alliance is that no one practice by themselves is going to be able to address this. It's going to take a lot of us working together. But even just the practices by themselves are not going to be able to address this. We need allies in this fight. We need to figure out together who can speak on which of the parts of this, and how are we going to be able to address this from different aspects with the different voices that are here. We all know that we're data-driven organizations. We know that without data, the anecdotes that entertain Congress people will not carry the same weight, so we need to figure out how we as a group are going to do this. So I'm going to start with a really simple question for the panel. So the assumption that we've all made is that we want to continue to deliver cancer care. Pretty simple assumption. And that we think that the best way to deliver cancer care is locally in a community oncology practice where the patients know who we are and that we can manage those patients in a way that provides them the best value. So the question would be, if you had to give us one suggestion of what we should be doing right now as the practices in the room for the future leaders who are going to be coming up with a plan, where would you start with that? And I'll start with Nick, because you're on the far end down there.